Hello, hello. Welcome back. Welcome back, everybody, to the CT Tech Cheat Code audio series. So, this is episode 5. In this episode, we're going to talk about reviewing orders and communication with radiologists. Now, we know that radiologists tend to not have a lot of respect for technologists who are unsure of their skills. So, we're going to fix that in this episode, okay? So, we're going to talk about orders versus clinical information, why both are important, when to call a radiologist and what not to say. Talk like a CT tech that's not scared. So don't be like a scared student, be like a confident tech, and how to clarify without sounding lost. All right. So, like I said in the beginning, there tends to be radiologists that don't really respect technologists a whole lot. And it has a lot to do with the dynamic of when they critically need something or we're questioning orders from other physicians and providers and we just need guidance. So there tends to be a lot of back and forth and a lot of resistance when it comes to the radiologist. So let's break down in this episode exactly the talking points that I'm going to go over, okay, and how we can go ahead and fix this dynamic. Even though this dynamic is not going to go away or fix itself overnight, but at least we can start the conversation and improvement. So, orders versus clinical information, why you need both. Now, we all see all the orders that we get that sometimes are ridiculous through the ER, upstairs, patient, you name it. We always want to make sure that the orders match the clinical information, the clinical history, diagnosis, what the patient came in for, the whole 9 yards, right? So it's important to read through both. Now, I know a lot of times we don't have time to read through all the patient's chart, the clinical history. Sometimes we do, especially when we get a very funky order that does not make any freaking sense. And sometimes radiologists will not help us out. So we have to make an executive decision. Okay. But we also need to remember the protocols that we follow. And I made an entire TikTok about this. So I will link it in the show notes as far as that, because I did have a radiologist respond to one of my videos. And I made 2 videos based on 2 of his responses. That there are times where radiologists will say, just do what they ask or do what they ordered. And then they want to come back and complain about why we did what they ordered, because that's not what is going to rule out what the patient came in for. Well, that is your job to make sure that as a radiologist, you give us the guidance and your knowledge on how to proceed, right? So a lot of times we do have to dig into the chart. We have to look and make an executive decision as far as, okay, and then be the middleman of the ordering provider and us, because the radiologist either fails to talk to them, doesn't want to talk to them, or doesn't want to get themselves involved and just says, do what they ordered. Okay. So a lot of times what's helpful, if you do look over the patient's history, if you're able to look in the chart and see if there's any history, any prior imaging, something to give the radiologist something when you need help. Now, when to call the radiologist and what not to say. Okay, I've seen this dynamic over the years. So when to call the radiologist, which goes back to my original point in my first talking point, is when you get an order that does not make any fucking sense and you have no idea what we should be scanning or what exam is the correct one for the patient. So that is your cue to call the radiologist, give them all the clinical history, why the patient's there, what they've ordered, and is this the correct order? Now, what not to say is to question their decision. I've seen techs challenge radiologists that will question, they'll say, okay, do X, Y, and Z. But why are we going to do that? I don't think this is right. It's not up to you. You're not reading it. Okay. You're scanning the patient, so you just do what they say. Now, if they make a wrong decision, your job is to just document exactly what they wanted, what you did, and per whatever radiologist, and attach their name to it. Because if it comes back to bite you, it's not on you, it's on them. So do not challenge the radiologist. If they just say, just do what they ordered, just do what they ordered. And if they want to complain, say, well, you said to do what they ordered, it's documented, and there you go. So that falls on their responsibility, not on you. Okay. Now, my next talking point is to talk like a CT tech that's confident, not like you're a scared student. Okay. Confidence, especially in our modality, it's a lot of moving parts, and we have to think very quickly, and we have such high capacity exams that we are constantly moving and turning over those rooms. So when you're talking to the patients, talk to them confidently, like you know what you're doing, you own the room, you're taking care of them, and they feel safe in your care. Because if you talk to them like you're uncertain, the patient's going to feel that you are uncertain and that you're scared and that you don't know what you're doing. So even if you're terrified inside, fake it till you make it. So make sure you talked to the patients and other providers too. When you feel uncomfortable about something, talk to them with confidence in a professional way. And trust me, it will get you very, very far. Okay. Everybody's scared in the beginning, but you build that confidence and you will see yourself going very far and you're going to be very successful. Now, my last talking point is how to clarify without sounding lost. So when we ask clarifying questions, you can say, listen, I really don't understand. Or you could say, okay, you're saying I should scan this and this and this. Is this correct? So when they give you, like if a radiologist gives you a protocol and says, okay, you need to scan this and this and this, read it back to them. It's the same way that the nurses read back orders to physicians when they order things. Read it back to them so that you clarify, okay, yes, this is it. Because if you sound like you're lost, they're going to think you're not a confident tech, okay, and that you have no idea what you're doing. So you want to be the tech that's in there that knows what they're doing, not a button pusher, okay? And I know I've said this in other episodes. You want to be the confident tech that knows what they're doing, even if you don't have a lot of experience. You still go in there and own the room. Don't be a textbook tech, because trust me, people can see it and they see that a mile away. Now, I have a CT Blueprint course that is a crash course for beginners. It will guide you on the very basic and, essentials that you need as a beginner when you're starting your CT training, that will get you going within your first year. So enroll in the CT Blueprint. You can thank me later. It will save your ass and it'll get you down to the principles that you should be knowing. So the link is in the show notes. So don't wait. Get your ass in that course. It's self-paced and you're going to learn a lot as far as, feeling confident in your training. Okay, so that is it for this episode. And hopefully these episodes are very impactful. I keep them very short, to the point, and just kind of get my point across. Okay, so thank you for listening to this episode, and I will chat with you in the next episode.